Almost inevitably, when I'm doing a cosmetic consultation for someone who's in their 40s or above, the topic of lip lines, also known as smoker's lines, barcode lines, vertical lip lines, lipstick lines, comes up, and people are really bothered by them. So today, we're going to talk about everything I recommend to fix lip lines. I'm Dr. Sam Ellis. I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Before I get too much into the video, I also want to say that lip lines are just a cosmetic concern. So if you have them and they don't bother you, it's no big deal. You do not have to fix them. I just find that so many women absolutely hate them, and so I want to talk about what you can do. I think the thing that really bothers women in particular about their vertical lip lines is that it prematurely ages them. Like, the rest of their face is doing pretty well, but when they look up close at their mouth, they feel like they look like their mom. The other thing is you almost never see these vertical lip lines in men, and that's thought to be due to the fact that they have what we call terminal hairs, or thicker hairs in the mustache area that really help support and almost act as a strut for the skin, so it's less prone to wrinkling or collapsing in on itself. And I know sometimes the world of cosmetics can feel a little bit more about art than it is about science, but there are actually really good studies and papers published about upper lip aging and the fact that when your upper lip changes, whether it elongates, which is a sign of aging, or wrinkles, it can make someone look older. So before we can understand how to treat and really address these vertical lip lines, I think it's really important to understand why they happen in the first place. So the main muscle that exists around the mouth is something called the orbicularis oris, and it is a circular muscle that tightens your lips and allows you to purse your lips. So you can imagine activating that muscle over and over and over again over a lifetime, whether you're eating, kissing, drinking out of a straw, or talking, is going to eventually start to etch those lines into the skin itself. The other thing is that over time, our skin thins out, it becomes more damaged, our collagen, which acts as a structural support protein, decreases, as well as the elasticity, which allows our skin to rebound and recover after movement, decreases. And so you combine that repeated muscle movement with the fact that the skin integrity is worsening, and you get lip lines. So when you think about the fact that these vertical lip lines are caused by a combination of things, that repeated muscular contraction in conjunction with loss of skin integrity, you may start to realize that treating these perioral lip lines also requires a combination approach. And when it comes to treating these lines, there are two things I really want to emphasize. One, that combination approach is so important. There is no single ace in the hole that's going to get rid of your lip lines. And when I'm talking to patients about how to improve their lip lines, I'm always very clear that a combination approach is needed to reduce them. And emphasis on the word reduce. The goal with lip lines is better, not gone. You will never be able to completely eliminate those lip lines. So the goal really is to make them better and prevent them from getting worse as time goes forward. So let's first talk about things you can do at home to improve your lip lines, because not everyone has access to a dermatologist. And honestly, I would argue that the things you are doing consistently at home in your regular routine are just as effective and just as impactful, if not more so, than things we do in the office. So the number one thing I'm going to talk about is lifestyle changes. And whenever I talk about lifestyle changes or things that you're doing on a regular basis to incorporate into your routine, I always want to make it very clear that it's whatever makes sense to you. I'm not asking you to completely restructure your life based on this lip line recommendation, but if this is a problem that you really have and you want to make it better, these are changes that might be worth implementing. So number one, of course, is going to be quit smoking. And most of you probably watching this are not smokers, and you're going, Dr. Ellis, like, I get these and I don't smoke. But if you happen to be a smoker, you need to stop. Not only is that repeated pursing causing those lip lines to form, but also smoking breaks down the collagen in your skin, so it worsens it that way as well. The other thing you need to stop doing, and I feel like this is actually the hardest thing for my patients to stop doing, is to stop drinking through a straw all day long. I really feel like I've seen this become a bigger issue as the Stanley Cup has become a big thing. Like, having a big jug of water that you are sipping on all day long has many health benefits, so I'm not asking you to stop drinking water. But if you are constantly pursing your lips around a straw day in and day out, minute to minute, hour by hour, you're going to etch in those lines so much faster into your upper lip. And really, straws aren't the only way that we purse our lips when we drink. So anything you're drinking out of that has a small aperture, whether that's a water bottle, a soda can, a little latte or like coffee cup, anytime you have to really push your lips together or make that pursing motion to drink, you run the risk of making your lip lines worse over time. I would say in an ideal world, you're drinking out of an open cup cup or a mug, or if you use a water bottle on a regular basis, it has a wide opening. Other things you can do in your day-to-day to reduce those lip lines, in addition to not drinking out of these tiny little openings, is to consider adding something like oral collagen to your diet. And I'll do an entire video dedicated to oral collagen and what the benefits may be, but the data is starting to show that it can improve things like skin hydration as well as skin facial wrinkles. So anything that we can do to support the structure and integrity of our skin is going to be helpful. And then one other thing that's really important to be mindful of if you're struggling with the appearance of the skin around your mouth is, what are your teeth like? Your teeth really serve as a support or a platform for your lips. So if you have tooth crowding or tooth decay or broken teeth and your teeth are not providing that structural support for your lips, that can make lip wrinkles appear more quickly. And that's something that's always part of my cosmetic consultations, especially with my older patients. Not only am I looking at their entire face as well as the things that they're focusing in on, but I'm also looking inside their mouth to make sure everything's supported well. And of course, I'm not going to talk about habits or things that you can do on the regular to support your skin integrity without talking about skincare. By far and away, the most common cause of degradation of your collagen, lack of structural support, and premature lip lines is UV damage to the skin. So you really need to be protecting that skin around your mouth, and sunscreen is the best way to do that. I also find that sometimes the lips are a little bit neglected when it comes to sunscreen, not only applying sunscreen to the upper lip, which seems to be commonly missed. I don't know if it's like hiding under the nose or whatever, but also using sunscreen directly on your lips to protect them. Because the reality is, even though you are seeing lines develop above your lip, it's actually the structure of the pink part of your lips themselves that also contributes to those premature lip lines. If your lips are deflated, sun damaged, lack collagen, then your lip and the area around your mouth is going to collapse more when you talk, and that's going to lead to deeper, more etched in lines over time. I have tons of videos dedicated to my favorite facial sunscreen, so definitely check any of those out if you're in need of a facial sunscreen recommendation, but I also think it's important to talk about lip sunscreen and how that factors in. I actually have a video on that too, but my all-time favorite sunscreen lip product is the O'Keeffe's Lip Balm. This is SPF 35, and the thing I like about it the most is that it doesn't have any gross sunscreen flavor. I'm very, very sensitive to that taste of sunscreen, and I essentially cannot detect it in this lip balm, so it's very easy for me to reapply and reapply over the course of the day without any negative effects. Aside from protecting your lips from premature aging, and you see like a lot of the things I was talking about even in your daily lifestyle interventions are all about prevention, you can also reverse some of the signs of those lip lines with topical skincare. And the best way to do that is with topical retinoids. You guys hear me talk about retinoids time and time again, these vitamin A derived molecules that work to promote collagen synthesis and prevent collagen breakdown. Aside from sunscreen, retinoids are the best anti-aging thing you can be putting on your face, including your upper lip. Now, I will say the upper lip, the area around the mouth, and anywhere around the nose tends to be one of the more sensitive areas because one of the main side effects of retinoids is irritated, flaky, red skin. And so you have to be a little bit careful with applying a retinoid in this area and making sure that you're not causing too much irritation. If you have a prescription retinoid like tretinoin, you can try applying that around the mouth, but if you're getting too much irritation, then you might want to move to a retinoid that's available over the counter and is a little less potent, but still effective. So the strongest retinoid that you can get over the counter is Differin, also known as adapalene gel. This is typically marketed towards people struggling with acne because retinoids are also very helpful with acne, but you can use this for anti-aging too. Another topical retinoid that I really like and I've spoken about many times is by Medicate, their Crystal Retinal. They have many different strengths of this retinaldehyde, which is another form of retinoid, and it can be a little bit more gentle or easy on the skin compared to adapalene. So if something like Differin is too irritating, you might want to drop down to this. And lastly, if you have really sensitive skin, but you still really want to incorporate a retinoid into your skincare routine, I would try the Olay Regenerist Retinol. This is a little bit more gentle, it's in a more creamy base, and you still get those skin strengthening retinoid benefits. So aside from sun protection and consistent use of retinoids, you also want to make sure that you're moisturizing that skin around your mouth really well. Any skin that is dehydrated or lacks moisture is going to look a little bit more shriveled, and those lines are going to be more obvious. And just the last thing I want to touch on when it comes to at-home things you can do to help with your perioral lines is use of certain devices. You guys might already know I'm not like the biggest fan of at-home devices, but I do really love my LED red light mask. Red light helps with things like collagen production, so I do feel like using my red light mask at home keeps the integrity of my skin optimized. There are a lot of great red light LED masks out there. I personally use the Omnilux mask, and I have an entire video dedicated to red light therapy if you're interested in knowing more about that as a technology. But I also just saw that Dr. Dennis Gross launched one that just goes around the lips. And I think if you're already using a face mask, there's really no need for this, but I do have this cohort of patients and followers followers who have messaged me over time being like, hey, I'd really love to use red light LED, but my eyes are a bit too sensitive for it. And so I feel like if you're trying to improve the skin around your mouth and you can't tolerate a full mask, this lip product really does have a place. So let's say you're doing all of that at-home work to improve your lip lines and you're not really getting to where you need to be. And I can completely understand that. A lot of what I already talked about is more about prevention and prevention of worsening. So let's discuss what I recommend in the office to improve the lip lines you already have. And again, when we're thinking about targeting the lip lines around the mouth, we either have to be intervening on the muscle that's contracting around the mouth and causing those lines to be etched in time and time again, or we have to focus on the skin quality and integrity and making that thicker and more resilient against those repeated muscle movements. So number one, probably the easiest and most cost-effective thing to do is Botox around the mouth. So Botox, which works by relaxing muscles, can be injected along the border of the upper lip as well as around the lower lip if you're struggling with lower lip lines as well, to just relax the intensity of that orbicularis oris muscle and reduce how much it purses when you talk or eat or go about your daily life. Now, you always have to be really careful about putting Botox in that area because the area around the mouth is highly functional. You can't completely relax it because then you won't be able to talk or participate in most daily activities like eating and drinking. So it's really about finding that sweet spot where you are reducing the intensity of the movement, but not eliminating it entirely. I also think Botox can absolutely be used in a preventative capacity around the mouth. So, oh my God, mom, don't hate me, but my mom struggles a little bit with the lines around her mouth. And I see that in her. And I see that when I talk, I activate that muscle quite frequently. And so it's not uncommon for me to put a little bit of Botox around my mouth, even though I don't have any lines yet, to prevent that from ever happening. And again, I really want to reinforce that you're trying to find that balance, because if you put too little in, you won't notice any improvement. But sometimes I have patients come back who've had Botox around their mouth a couple of weeks ago and it's fully kicked in and they're like, look, Dr. Ellis, I can still purse my lips a little bit. Yes, that is the goal. I still want you to be able to use your lips in a functional capacity, just reduce the intensity. I do find that if you have active Botox in your upper lip, it is hard to do certain activities like drink out of a straw. So sometimes I tell my patients, this is like training you to not have that other habit that's contributing to your lip lines. If you've ever had Botox in your upper lip or you're even thinking about getting it, I will warn you, it definitely feels kind of weird when it's first kicking in those early weeks. For example, if you're swishing water in your mouth, like when you're trying to brush your teeth, you might feel like you can't create a tight seal. Or if you're talking, you might feel like you can't create a really intense or ma, because you have to really engage your mouth for that. So people I will never inject with Botox around their mouth are people who do a lot of public speaking, or they play an instrument like a trumpet. And you might be like, wow, Dr. Ellis, you treat a lot of artists. But yeah, I do treat a lot of people in the industry. And so you have to make sure that you're not going to affect their ability to do their job. But the intensity of that also wears off over time. So if someone does do a lot of public speaking, but they have no engagements in the next couple of weeks, I think it's completely fine to go forward with that treatment, really as a prevention for future worsening of those lines. The next thing I want to talk about when it comes to treating those lines around the mouth is fillers and what role they really have. Because probably the most common request I get from a patient in a cosmetic consultation is, hey, Dr. Ellis, can you fill these lines around my mouth? And you have to be so careful about doing that. So hyaluronic acid based fillers are really a gel that can be injected in different parts of the face to give structure and to smooth fine lines. And so it would make sense that you could use them around the mouth in those tiny little lines to help plump them out. And you can to a degree, but you have to be so careful that you do not overdo it, because what we want is reduction of those lines without changing the architecture around the mouth. And what I find, if you're out in the community and you're looking at someone going, wow, their lips look weird, or their lips look ducky, or you just are noticing their upper lip, oftentimes it's not because they have too much filler in the lips themselves, but they've had filler placed above their lip, often to improve those fine lines, but it's way too much. And so a lot of the time what I tell patients, kind of in a joking manner, is if you give me enough filler, I can make any line go away. But when we step back and look at you as a whole, will you look better or more balanced? And that is really the most important aspect of cosmetics, is that you are not chasing a tiny little line or a tiny little wrinkle, but rather when you step back and look at the person's entire face, they just look better. So I am very, very conservative when it comes to putting filler in the what we call upper cutaneous lip, also known as the ergotrid. I put tiny amounts in those wrinkles, but I never ever overdo it. So in my personal opinion, filler in the upper lip needs to be done very conservatively. And like I mentioned in the beginning, the goal with lip lines is better, not gone. And I really emphasize this with my patients. It is much better to have an improvement in your lip lines and still have them be there to some degree than to completely blast them away with filler, but then have your lips look weird. And I also will say it actually is very helpful to put filler into the lips themselves and not just above the lip if someone is struggling with perioral lip lines. And again, that's because your lip itself gives support to the upper part of the lip. And if your lips are deflated and not filled with moisture or suppleness, then the lip wants to collapse in on itself. So it's not uncommon that it will also place a little bit of filler in the lip itself when I'm treating the perioral lip lines. And a lot of times patients are really nervous about this because they've seen the weird lips out there. They think they can get away with just doing it in the upper lip, but you really need that balance. For many of my patients who struggle with these perioral lip lines, we will often be putting a very small amount of filler in the upper lip, maybe once a year, and then doing Botox a few times a year, and that combination works quite well. In addition to doing things like Botox and fillers, it can also be really helpful when treating the perioral lip lines to actually improve the quality of the skin itself with certain procedures. So things that I do in my office that can help include things like microneedling or even radiofrequency microneedling, so inducing some heat into the microneedling, which makes it a bit more effective. You can also do things like laser resurfacing, and I would say that like gentle laser resurfacing is usually not enough to induce any meaningful change in the lip lines. Typically, you need an aggressive laser treatment to help with those perioral lip lines. So usually we're thinking about something like CO2 laser or erbium laser. These are what we call ablative lasers. So they are truly vaporizing some of the tissue around the lip to get it to contract and to improve collagen production. I hate to say it, but when it comes to the lines around the lip, it's a little bit of like no pain, no gain. In addition to using lasers, you can also use things like chemical peels to induce new collagen production. There are also newer devices coming to market that use something called microcoring technology. So for example, the brand Ellis has created a device where you essentially stamp something over the skin and it takes out little cores of skin. So you're getting similar tissue contraction to with a laser, but you're not really delivering any heat to the skin. And this is relatively newer technology, but I have seen some really good results in terms of improving upper lip lines with that intervention. I think something though that is so important to keep in mind when you're treating upper lip lines is that you often don't just treat the upper lip. You often want to treat the rest of the face as well, because if you just treat the area around the mouth, sometimes there's too sharp of a line of demarcation between the cheeks or the nose or the untreated part of the chin and the perioral region, and you really want all of your skin to be on the same age page. And also some of these more aggressive procedures like microcoring and CO2 laser and erbium laser do come with more risk of infection, risk of getting hypopigmentation or irregular pigmentation around the mouth that can be prolonged and rarely permanent. And so it's really important that if you are having this procedure done, you're discussing all these risks with your provider and you're picking a provider who's very experienced and can minimize those risks for you. I also want to give a quick shout out to surgery and the role that plays in rejuvenating the skin around the mouth. So like I mentioned earlier, not only as we age do we get these lines that increase in the upper lip, but also the lip length lengthens, and that can really age people. So if you're treating those lines, but you also have a very long upper lip, you could consider a surgical lip lift in which they cut out a little bit of skin right underneath the nose and actually lift the lip up. That can make the lip look a lot better, but again, it is surgery and has its own set of risks. I hope these tips were helpful. I feel like I have a conversation about lip lines every single day in my clinic. And so being able to see what kind of conversations I'm having for patients and what things I recommend might help you make meaningful interventions for you as well. If you've used any products or made any lifestyle changes or had any procedures that have helped with your lip lines, definitely let me know your experience in the comments. Thank you so much for watching. Don't forget to like this video and subscribe to the channel, and I'll see you next time.